Degenerative disc disease is a condition that occurs in everybody as they age. It is more severe in some people than in other people. There are genetic factors that affect how severe it is. Weight, of course, affects the severity, and people who are smokers tend to have more degenerative disc disease. It's related to loss of hydration in the disc, and as the disc becomes dehydrated, it starts to collapse and it no longer provides the cushion that it needs to provide for the spine. Because there is no cushion, patients tend to get back pain, and that is the most common symptom with degenerative disc disease. The back pain is the predominant pain and is most prevalent when the patient is sitting or standing. It improves somewhat with walking. The patient may also have leg symptoms, including pain, numbness, or weakness. They tend to be not as severe, but they can also cause significant disability to the patient. The most common test used to diagnose degenerative disc disease is an MRI scan. This accurately tells the doctor the status of the disc and whether it is the source of the patient's symptoms. Degenerative disc disease is primarily a disease that is treated by non-surgical measures. It is treated with epidural steroid injections, medications, physical therapy, and I usually recommend a core training program such as yoga or Pilates. Surgery is a last resort and is not often very effective. It is not recommended unless all other treatments have been exhausted and the patient still has severe pain. The risks of surgery for degenerative disc disease are primarily related to the poor outcomes. The most common treatment that people have for degenerative disc disease in a surgical fashion is a fusion. However, the success rates for fusion are quite poor and on the order of 50 to 60%. Because of the low success rate, surgery is generally not recommended for degenerative disc disease.